Section 1. Introduction, a pervasive problem. It's a silent struggle. Millions of adult children are grappling with the painful legacy of narcissistic parents. These individuals often feel trapped, controlled, and emotionally drained. They yearn for a healthy relationship with their parents, but the reality is far from their dreams. Narcissistic parents operate from a place of self-absorption and a lack of empathy, leaving their children feeling invisible and unimportant. Narcissistic personality disorder is a serious mental health condition. It affects a significant portion of the population. The impact on families can be devastating. Children of narcissists often grow up in homes that are chaotic and emotionally unstable. They learn to prioritize their parents' needs above their own, leading to a diminished sense of self-worth. It's a cycle of dysfunction that can repeat itself through generations if left unaddressed. This essay will explore the dynamics of narcissistic parent-child relationships. We will examine the signs of narcissistic behavior, the impact on children, and provide practical advice for setting boundaries. Remember, you're not alone in this journey. Many resources and support systems are available to help you navigate these complex relationships. It's time to take back your power. You deserve to live a life free from manipulation and emotional abuse. By understanding narcissism and setting healthy boundaries, you can break free from the cycle of pain and begin to heal. Section 2. Defining Narcissistic Personality Disorder. Narcissistic Personality Disorder, or NPD, is a complex mental health condition. It's characterized by an inflated sense of self-importance, a deep need for admiration, and a lack of empathy for others. Individuals with NPD often have a grandiose view of themselves. They believe they are superior to others and deserve special treatment. This inflated ego often masks deep-seated insecurities and vulnerability. NPD can manifest in various ways. Some individuals are overtly arrogant and demanding, while others are more subtle and passive-aggressive in their behavior. Common traits include a constant need for attention, a sense of entitlement, and a tendency to exploit others for personal gain. They may be highly sensitive to criticism and react with anger or defensiveness when their self-image is threatened. It's important to note that not everyone who exhibits narcissistic traits has NPD. This disorder is diagnosed by qualified mental health professionals based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. If you suspect someone you know may have NPD, it's crucial to encourage them to seek professional help. Section 3. The Narcissistic Family Dynamic. Families with a narcissistic parent often operate in a state of dysfunction. The narcissist's needs take center stage, while the needs of other family members are minimized or ignored. Children in these families often feel invisible and unheard. Their emotions and experiences are often dismissed or invalidated. The narcissist may use manipulation, guilt trips, or emotional blackmail to control their children's behavior. The non-narcissistic parent often plays the role of enabler. They may try to appease the narcissist to avoid conflict or protect their children from the narcissist's wrath. This dynamic can create a sense of confusion and instability for the children. They may witness their non-narcissistic parent being mistreated but feel powerless to intervene. Children of narcissists are often assigned specific roles within the family. The golden child is favored and admired, while the scapegoat is blamed and criticized. These roles can be fluid and change depending on the narcissist's mood and needs. This creates a competitive and emotionally charged environment where children are constantly vying for their parents' approval. Section 4. The impact on children. Growing up with a narcissistic parent can have profound and lasting effects on children. They may struggle with low self-esteem, anxiety, and depression. The constant emotional invalidation and manipulation can lead to a distorted sense of self and difficulty forming healthy relationships. They may also develop a fear of abandonment and become overly dependent on others for validation. Children of narcissists may also experience difficulty identifying and expressing their emotions. They may have learned to suppress their feelings to avoid conflict or displeasing their narcissistic parent. This emotional suppression can lead to physical health problems such as headaches, stomach aches, and insomnia. They may also engage in unhealthy coping mechanisms such as substance abuse or self-harm. The impact of narcissistic parenting can extend into adulthood. Adult children of narcissists may struggle with relationships, career choices, and setting healthy boundaries. They may attract narcissistic partners or friends, recreating the familiar patterns of dysfunction from their childhood. It's crucial for adult children of narcissists to recognize the impact of their upbringing and seek support to heal from the emotional wounds of the past. Section 5. Setting boundaries: a path to healing. Setting boundaries is essential for protecting your emotional well-being when dealing with narcissistic parents. Boundaries are limits we set to define what behaviors we will and will not accept from others. They are a way of communicating our needs and expectations. With narcissistic parents, setting boundaries can be particularly challenging as they are often resistant to any perceived limitations on their behavior. The first step in setting boundaries is to identify your needs and values. What are the behaviors that are unacceptable to you? What are your non-negotiables? Once you have a clear understanding of your boundaries, you need to communicate them to your parents. This can be done verbally or in writing. Be clear, concise, and firm in your communication. Remember that setting boundaries is not about controlling your parents' behavior. It's about protecting yourself from emotional harm. You cannot force your parents to change, but you can choose how you respond to their behavior. Setting boundaries allows you to take back your power and create a healthier dynamic in your relationship. Section 6. Maintaining boundaries: strategies for success. Maintaining boundaries with narcissistic parents requires consistency and vigilance. Narcissists are skilled manipulators and will often test your boundaries to see if they can regain control. It's crucial to stay firm and not give in to their tactics. Remember that your emotional well-being is your priority. One strategy for maintaining boundaries is to limit contact with your parents. This may mean reducing phone calls, visits, or social media interactions. You may also choose to avoid discussing certain topics that trigger emotional distress. Remember, you have the right to control the level of engagement you have with your parents. Another important strategy is to detach emotionally from your parents' behavior. This means not taking their words or actions personally. Remember that their behavior is a reflection of their own issues, not yours. Try to maintain a neutral and detached stance, even when they are trying to provoke a reaction. Section 7. Seeking support and validation. Navigating the complexities of narcissistic parent-child relationships can be isolating and emotionally draining. It's vital to seek support from others who understand your experience. This may include therapists, support groups, or trusted friends and family members. A therapist specializing in narcissistic personality disorder can provide valuable guidance and support. They can help you understand the dynamics of your relationship, develop coping mechanisms, and set healthy boundaries. Support groups can offer a safe space to share your experiences, connect with others who understand your struggles, and gain validation for your feelings. Remember that you are not alone in this journey. Many people have experienced the pain of narcissistic parenting and have found healing and recovery. Sharing your story with others who understand can be incredibly empowering and validating. It can also help you break the cycle of silence and shame that often surrounds these relationships. Section 8. Conclusion: hope for a brighter future. Dealing with narcissistic parents can be one of the most challenging experiences in life. However, there is hope for healing and growth. By understanding the dynamics of narcissism, setting healthy boundaries, and seeking support, you can break free from the cycle of pain and create a brighter future for yourself. Remember that you deserve to be treated with respect and dignity. You have the right to set boundaries and protect your emotional well-being. It may not be easy, and there will likely be setbacks along the way. But staying committed to your healing journey is essential. The journey to recovery from narcissistic parenting is a marathon, not a sprint. Be patient with yourself,